Hi all, Marissa Rushlow with Lingual Abilities here, coming to talk to you today about occupational therapy. You might be thinking, wait, Marissa, isn't your company speech therapy? And while that's true that we started as a speech therapy practice and I am a speech pathologist by trade, we've expanded our services to reach more clients with all their therapy needs, including occupational therapy. So what is occupational therapy, or OT? Well, the occupation part of the name basically refers to whatever activities define the child's life, such as school's responsibilities, play, or artistic expression. OTs can work privately or in schools to make sure that children have access to their environment and can succeed in it with greater independence. In short, they're making sure that kids can be more independent at school and home for their occupation, whatever your family defines that as. OTs often work beside other providers, such as teachers, speech pathologists, and physical therapists to help their clients. They also work closely with families to help them understand their child's development and functioning. In order to practice, OTs receive a master's degree in occupational therapy and are licensed by the state. Many therapists have the letters OTR/L after their name, indicating that they are a registered and licensed therapist. So let's talk some signs that your child might benefit from occupational therapy. Here are some of the common signs. 1, your child struggles with handwriting, drawing, or computer use. OTs work on fine motor skills. 2, your child needs adaptive equipment such as a wheelchair or pencil grasp. So OTs help in terms of accessing your environment. 3, your child can feel overwhelmed by their senses, such as being very sensitive to cold or bothered by daily noises at home. So OTs can help with our sensory regulation. 4, your child has difficulty regulating their emotions and can lash out when upset. OTs also help us regulate our senses and our emotions so that we can better access our environment and regulate in the real world. So OTs cover a lot of things for kids, but they essentially help children learn skills needed for everyday life, from buttoning their jackets to writing and regulating their emotions or dealing with sensory overstimulation in the world. There are many benefits to working with an occupational therapist. And if you think your child might need OT, we can help you determine how to get started. Check out the link in my description to book a free discovery call today. No obligations, no pressure. Just free information on how we can help you decide if OT is right for your child. Thanks, guys, and I'll see you in the next one.